Ah, look at you. Awesome, Shelley. Okay.
Sally.
All right, go ahead.
Perfect. Well, good afternoon, everyone. Thank you so much for joining us for BHN Office Hours. It is April 2024 already. I can't believe it's already April. And this is actually my first office hours that I get to moderate. And so I'm just so
Mhm.
honored that you guys are the ones sharing it with me. I'm Mckenzie Harris. I am the chair-elect for the BHN DPG. It's an honor and privilege to work alongside people like Jennifer. We're actually friends as well as work together on BHN, so this is perfect. Um, just a little bit of housekeeping. I will be admitting people and kind of monitoring the chat and asking you guys to kind of mute yourselves or muting you for you just throughout the presentation to make sure that Jennifer can kind of just stay focused, get through the presentation, and you feel free to unmute at the end. This is being recorded, so please just make note of that. If you do not want to be on camera, please turn your camera off. Um, but outside of that, we'll have the presentation during the first half of today's hour, and then we will stop the recording and have open time for questions. So if you guys have questions, feel free to put in the chat. I'll answer them as I can, or I can kind of give you guys a little bit of answers if it's any technical questions. If not, we'll wait till the end for discussion. All right. And then this is Jennifer Haynes. She's wearing multiple hats for us right now. She is acting as our mental health resource professional, as well as our membership chair. She is pivotal for BHN, if you can't even imagine. And so she'll be presenting today on nutrition and mental health. So take it away.
Awesome. Thank you. While you were talking, like three more people joined. So really big group for us today. I'm excited. So I hope that means that this topic is resonating with people. So as we talked about in the email blast and social, we're going to talk about nutrition therapy for anxiety disorders. Why? There we go. Sorry, I've only presented with Canva a couple times. So if you see me like try to figure things out, if y'all could mute yourselves too, if you're not already. But if you see me trying to figure out why things aren't moving, that's why I'm still getting used to Canva presentation. So like Mckenzie said, my name is Jennifer Haynes. I am the owner of Go You Nutrition Counseling. It is a private practice here in North Texas that focuses on nutrition for mental health. And I'm also trying to start Mood Matters Dietetics. That is going to be more kind of what I'm doing here, trying to help educate other dietitians on this. I am certified in mental health first aid, and I am the membership chair of the Behavioral Health Nutrition DPG. So, we always start with statistics, right? So, about 19% of Americans experience an anxiety disorder throughout the year. Now, we do kind of think of anxiety as just what this person is, but in reality, anxiety disorders can flux, right? We can have periods where we are experiencing it, periods maybe where we generally don't talk about it as like remission, but where, we're less affected by it maybe. But depression and anxiety is a huge factor around the world of disability. So it costs estimated around the entire world $1 trillion a year from lost productivity, inability to work, inability, maybe needing food stamps because of that, food insecurity, housing insecurity, things like that. So you can kind of see some of these things. And I think like logically I knew this, but like actually seeing the number, 47% of Americans with a mental illness received treatment in 2021. Um, Keeping in mind, the argument could be made that there was a lot more need for mental illness treatment in 2021, but that's still pretty poor, right? Obviously, there's certain areas around the United States that are better at this than others, but 47% is pretty bad. So just, kind of highlight the reason why maybe we need to be doing more to help our clients with mental illness as well. So what are the anxiety disorders? These are disorders that are persistent and excessive worry that interferes with their relationships, with their daily activity. This is not something that they can just like think positively and it goes away. Sometimes it does actually worsen over time. One of the things my clients express to me a lot is, well, I shouldn't feel anxious, right? I have no reason to, but like my kind of counter argument, I guess, out of that is if you had a reason to feel anxious, that's not an anxiety disorder. That's a normal human response to something that you're stressing out about, right? So a lot of times people have a lot of feeling of guilt because they're feeling anxious and they perceive that there's not a reason for it, right? So when we're going through these, sorry, this bar is hiding some of my stuff too, but I think the most frequently one you're going to see is this generalized anxiety disorder. because it is so prevalent, I feel like some people tend to write it off, but this is a very impactful disorder on their life. So they may feel dread, they may feel tired, wound up, easily fatigued. They'll have sleeping problems, so they may sleep more to avoid the anxiety, right? But other times they'll feel so anxious that they can't sleep. Anxiety also tends to present with pain, usually in the head and the stomach, but it can be, systemic, generalized throughout the body as well. As they are more anxious, they have a difficulty concentrating. Obviously, you can be really irritable with that. So, generalized anxiety disorder is not like the mild anxiety disorder, right? It's very, very impactful on their lives. We also have panic disorders, social anxiety disorder, obsessive compulsive disorder, PTSD, and phobias. So OCD, I always like to kind of put a little bit of information out there. So you have these patients that experience an obsession that are causing a lot of anxiety and distress. And then they have compulsive behavior that is their way of protecting themselves, feeling safe from this feeling of anxiety and obsession, right? Sometimes you may see one or other or both. It kind of depends. This does tend to get worse when there is some kind of stressor, like actual physical stressor there that is causing them to feel worse. Sometimes it may disappear. Also, behavior may change. So somebody that is almost germophobic and washing their hands may later on have other compulsions, right? So it just kind of depends on where the brain is going, what's going on in their life, and stuff like that. I do always like to stress with OCD that this isn't a minor, like, oh my gosh, I have to have the dishes cleaned at night. So, like, you wanting to have your dishes cleaned at night is not OCD. That's just a preference, right? It's very, very different. So, we want to make sure that we're not belittling the struggles that people with OCD do have. So there's my little soapbox on OCD, right? So then we have separation anxiety disorder, selective mutism, medication-induced anxiety disorder. So we don't see these quite as often. Separation anxiety tends to be more children. Adults can experience it too, but it's usually in kids. So generalized symptoms that you could see: excessive fear or worry. Now, not everybody verbalizes these things, but you may hear somebody speak about things that seem outlandish to you. That would never happen. Why are you worried about it? That kind of thing. Not everybody verbalizes these thoughts, though. You may notice people having trouble concentrating. They can't make decisions. They're irritable or restless. You may notice a lot of GI, nausea, complaining about bloating, maybe going to the bathroom more often, that kind of thing. Heart palpitations. So a lot of patients with anxiety are actually on beta blockers because their heart beats so hard that they're actually feeling, it's like a cycle. It creates a cycle of heart palpitations worsening anxiety and anxiety worsening that. So you may see sweating, trembling, or shaking depending on. Obviously, this may be a little bit more obvious in things like phobias or PTSD. Trouble sleeping, and sorry, I can't talk. Experiencing doom, danger, panic, things like that. So why, as a dietitian, is this something that we need to think about our influence on? So there are four kind of main metabolic factors that can either cause or influence anxiety. So oxidative stress, insulin resistance, inflammation, and GI dysbiosis. So you can see I tried to put the sources kind of where we were talking about it there, but we have impact on all of these things. Even if we're not talking about, mental health in particular, we do have impact with what we can do to help influence all of those factors. So first, I always like to talk about the gut-brain connection. I think by now everybody's heard that there is a gut-brain connection, right? We talk about it, we hear about it in social media, all that kind of stuff too. And the truth is, the gut and the brain do communicate bidirectionally. They go back and forth via the vagus nerve. So even people that don't have an anxiety disorder, let's say you had to give a presentation or like speech in high school or something like that, and you were so nervous that you felt like you were going to throw up, or maybe you did throw up, right? So that's kind of a maybe not quite as consistent, but just kind of a way to highlight that you do see that connection between the gut and the brain. If you feel like you're in trouble, if you get scared all of a sudden, things like that, you experience some kind of GI problems, right? And furthermore, people that have a functional GI problem tend to experience pain more acutely in their gut. When their gut is feeling a lot of pain, it's sending distress signals to the brain, and then the brain will feel stress and then increase that stress back down into the gut. So they kind of have this negative like feedback loop where one is making the other worse and they're going back and back and forth. So our goal is to stop that cycle, hopefully reverse it, where we can get them talking. This sounds silly, but like more positively to each other, giving them good, like it's okay signals, right? Instead of distress signals back and forth. Um, Sorry, I'm gonna shut this down real quick. So, dysbiosis and inflammation has been, this isn't something that's like new information or new thought processes. They've been looking at this for mental illness for years and years and years. Just kind of wanted to throw that out there because I feel like a lot of times we kind of get like, well, this is new. We don't really know that much. We actually know quite a bit about this connection between and exactly how, like, what the methods are and stuff like that with it. There's still a lot more to learn, but that we know a lot already. So that article right there is really interesting if y'all want to go read some of that. So in general, when you're looking at nutritional psychiatry, a lot of the studies that you can look up, they will try to address depression and anxiety, and you'll see a lot of really positive results on depression, but not necessarily anxiety. So it does appear to some extent that anxiety does not respond directly to nutritional interventions in the way that the mood disorders, so like depression, sometimes bipolar disorder and stuff do. We tend to, with anxiety, maybe we need to think of more of a roundabout way. Maybe it's not quite so direct, but there's definitely a lot of things that we can do. I always like to think of nutrition in general, honestly, but for anxiety in particular as like a progressive approach, right? And I'll show you what I mean by that in a second. But ultimately, if our patient is not eating consistently and eating enough, then their brain function is going to suffer, right? Obviously, that makes sense logically, but in reality, to the client, at least, that doesn't always seem so obvious. So this is kind of based off of the Maslow's hierarchy of needs. I use this a lot with my clients. So down here at the bottom is adequacy. Is your patient eating enough? If they are not eating enough, that is the first thing. It does not matter what they eat. It does not matter how many proteins and carbs and fiber and all that kind of stuff. If they're not eating enough, that is the first step that we need to take, the first thing that we need to approach, right? Second is that balance. So that's when we worry, okay, we're eating enough throughout the day. Maybe we have a little bit more energy because of that. And then are we getting enough protein? Are we getting enough fiber for our gut to be healthy? We can kind of look at some of that balance. And then more for the gut, we want to start looking at variety. So obviously we want to avoid micronutrient deficiencies and having a variety. So like a common argument I have here in our house is, well, I eat broccoli. Why do I have to eat anything else? I'm like, well, broccoli's fantastic, but so are carrots, so are potatoes, so are, other things. So we want to have that variety, largely because we want different micronutrients, excuse me, but we also want different fibers. Our gut really, we talk about certain fibers a lot as prebiotic foods, but there's a lot more noise about certain phytochemicals being prebiotic. And if we're, not getting a variety of those, we may be missing out on helping some beneficial bacteria there. And then we have these individual foods. So maybe supplements, maybe functional foods, maybe we need to look at a balance, things like that. That's the very tip top peak of that. So not to belittle it, but maybe like the least important. All those on the bottom need to be taken care of first. However, most of the people that I see, they want to start up here. They have no concept that they're not eating enough. This balance is really kind of, to us, maybe it seems logical, but to them, they don't really know what that means. Variety, maybe they're a little picky. They don't want to do things like that. But somebody on social media told them that if they eat this, then it'll fix their anxiety, right? And so they're very pinpointed and exposed to this very top of the pyramid. Generally, I find that none of those things at the top of the pyramid are going to help if the bottom isn't covered, right? So hopefully that makes sense. So again, we've all seen these clients, and I see this all the time. They have black coffee for breakfast. Maybe they eat midday, but a lot of them don't eat till dinner. They eat dinner with the family, and then they sit down and they snack and they snack. Or maybe they don't, and they just have this really, really big dinner, and they kind of feel miserable because they overate. But either way, they're going to have this wildly fluctuating widely, I think I meant to say widely, not wildly, fluctuating blood sugar where they're running really low, running really high sometimes. And so that's going to increase these feelings of anxiety, particularly that low blood sugar. They're not going to be able to concentrate. Ultimately, the brain's just not going to work, right? When they're not getting adequate nutrition in throughout the day. Most of these clients that I experience, and y'all may chime in a little bit, at the end if y'all see this and your clients are not, but generally they don't feel hungry. I don't eat because I'm not hungry, right? Forgetting that in the past they did eat consistently, right? But it's just been so long. There is this concept of adaptive thermogenesis. Social media, you'll see it called like starvation mode is, I guess, the closest that we have to that. But ultimately that can increase their leptin levels. So they legitimately don't feel hungry, but rather than utilizing their energy intake to function and make their brain function normally, they're storing energy, right? So we want to make sure that we are teaching them to eat frequently enough that their body's not in that protection mode and trying to prevent themselves from, starving, that kind of thing. So this is really, really important. Usually what I do with my clients, well, first of all, if you think a client's not eating enough, you've got to screen for an eating disorder. Not necessarily what this presentation is, but in the rest of this presentation, we're going to pretend we know for sure our client does not have an eating disorder, right? But they've got to be screened if they're not eating enough. Maybe even if they are, just something, a few questions to ask, right? But generally, what we do is I have them eat at regular intervals. Most clients are on board to eat every 2 hours. I found some of them aren't just because it seems like a lot for whatever reason, but we need to get in more frequently. This is not because there's some magic number at every 2 hours. That's how you get enough nutrition. It's not going to like fix their metabolism or anything like that, but it's getting them eating in a proportion that's maybe smaller because it can be hard to eat a whole meal when you're not hungry, right? But they're eating more frequently throughout the day. They're putting that nutrition in. So they may be having like a stick of cheese and some grapes, right? So these aren't huge, huge meals, but it's enough to get that more frequent eating so that their brain is getting fueled better throughout the day. I have never had an intervention with a client work as well as this one. So I do it pretty consistently. Usually by the 2 weeks when I see them again, they are feeling more energy, sometimes less anxiety. That depends on a lot of things, but they're sleeping better. They are less brain foggy. They're not having that super, super large meal that makes them feel kind of yucky at the end of the day. And most of them have already had their hunger cues return. So usually if that happens by 2 weeks, they're not eating every 2 hours anymore. They're eating whatever their pattern is, maybe 3 meals and 2 snacks, or 2 snacks and 2 meals, or whatever fits better for them. They're at a better point where they are already starting to listen to their body better. So again, eating disorders, this can take longer. This may not be appropriate. So that's why it's so important to screen, right? I also do tell people, it doesn't matter what you eat, like just eat something. And I've had some people say like, oh, I'm gonna eat Pop-Tarts. Like, fine, whatever, eat your Pop-Tarts, right? Most people are not taking the time to see a dietitian to be told it's okay to eat Pop-Tarts. So I usually have them maybe get a protein and a produce, or a protein and something else, or we kind of figure out what they're willing to do and what feels comfortable for them just to get that nutrition in more frequently. So after that, we start talking about balance. The AMDR is 100% fine. I know there's a lot of arguments over what's low protein or low carb and all that kind of stuff. The AMDR is totally fine. I have never seen anybody that like doesn't fit somewhere within that range and does really well. Generally speaking, how active are they? Somebody that is super, super active is going to need more carbs, right? So y'all know all of this already. But essentially, if we're not eating enough carbs, we're going to have low energy level. We're going to have brain fog. That's probably going to decrease our fiber intake unless we're taking something to supplemental fibers everywhere nowadays. But if we don't eat those things, we're having lower fiber intake, which could make our gut worse. We also need those carbs to move our tryptophan into our brain to make serotonin and melatonin. So if we don't have that, we have bad mood, we're irritable, we're not sleeping as well, those kind of things. So we want to make sure that we're getting enough of those. And then obviously we know fat, protein, getting those in is going to increase satiety. It's going to taste better. We're going to enjoy our food more, that kind of thing. So I do see a lot of people that claim to be addicted to sugar that tend to have that abate a little bit when they do have more of that fat and protein throughout the day. Not everybody, that's kind of a contentious area of nutrition right now, but a lot of people do experience that. So in reality, a lot of people tell me they want numbers, but they actually just kind of want like the food goal, right? And so we may talk about how much protein they need, how much fiber they need, but most of the time my clients choose goals that are, maybe they don't eat vegetables, so they're going to eat one vegetable every day, or they don't eat a lot of protein, so I'm going to have protein every time I eat. So that's kind of how those look at. I'm not a real big fan on journaling and being super, super specific about this. Obviously how you practice and how your client prefers. I do have clients that love numbers, so everybody's a little different like that, but just kind of figuring out, making sure you're getting that balance in. And then for variety, I feel like I'm talking really fast. If you need to slow me down, go ahead. But we want to get those variety in, right? Different fiber sources, different micronutrients, all that stuff we already talked about. But essentially, the different fibers are feeding different bacteria, and we want to feed as many of them as possible. So one of the things that I like to tell people a lot is we have to get away from this idea of like a black and white, good bacteria, bad bacteria, right? Obviously there's bad bacteria, right? Like we're not talking about like introducing all the C. diff, right? But we want to make sure that we're looking at a diversity and having as much of a diversity of bacteria as possible, rather than only having this good bacteria and this not having this good or bad bacteria, excuse me. Also, it's just more fun, right? People can experience a little bit more, maybe try a new vegetable, try a new cuisine, right? So I went to Allen a while ago, I don't know, about an hour out from where I live, and there's like 4 different, cuisines of African restaurants. I'm like, "I had no idea this was down here," and it's like, I don't have to go to Dallas like I thought I did to have stuff like that. So there's 4 restaurants I can try, right? We're in an area that is really diverse, so we can do that. Obviously, that's gonna depend a little bit, but trying new cuisines, new spices, looking at Pinterest for new ideas, things like that, it just makes this a little bit more fun for most people. Some people don't care, but most people like that. Um and then moving on to this individual foods, individual nutrient idea, this is where really people think that the bulk of this is going to be, right? So there are some things that can make it worse, right? So caffeine is very strongly tied to anxiety symptoms, but people tend to not make that connection because coffee intake, energy drink, whatever, it tends to be habitual. Get up, drink coffee, right? So it's not like people can notice on days I drink coffee, I'm not anxious because there are no days that they don't drink coffee, right? Heavy coffee drinkers or caffeine drinkers in general, it may be better to reduce their caffeine intake because sometimes those withdrawals are so bad, they're worse than the anxiety, right? So we do need to, again, take the client into account. A lot of times, if it's an all day caffeine habit, we talk about like cutting it off at a certain time or maybe switching to decaf. So there's like a little bit of caffeine, but not a whole lot. Again, individuals are going to look at that a little bit differently. This one's really hard. A lot of people are like, you know what, we'll come back to caffeine. So, again, take your client into perspective. Alcohol does worsen anxiety. A lot of people will drink alcohol when they're really stressed because it kind of gives them an initial feeling of calm. But as you continue to drink, and as that alcohol is metabolized, it does tend to make people feel edgy, and their quality of sleep does worsen. So as their sleep worsens, we have this again, another feedback loop where anxiety is getting worse the next day. We do see a much higher risk of anybody with mental illness having substance abuse problems. So this is something that, even though it can be uncomfortable to talk about sometimes, alcohol use should be addressed. That's a question on my screening form. Every single client I see reports their alcohol intake. I don't hound them on it, but it is something that I feel like I need to know about them. Fermented foods, in general, but really fermented dairy is where a lot of the research is. And same thing, this is to make the gut feel better, right? There is some newer research that the fat in fermented dairy, like so in yogurt and cheese and stuff like that, is actually anti-inflammatory. And we do know, again, that a lot of mental illness, but particularly depression and anxiety, these are systemic inflammatory processes. So if we can get that inflammation down a little bit. The other thing with fermented food, everybody loves to talk about pickles, kimchi, sauerkraut, things like that, and they can be fermented, but many times they're actually brined. So if they're on the like shelf stable section of the store, those are usually brined like with vinegar, not actually fermented. So they're not bad for you at that point, but obviously if you're taking those to be your probiotic or your fermented food, that's not going to count for that, right? Also, you can't cook those things. I think a lot of clients forget that. But we do see that psychobiotics, so whether you're taking a supplement, whether you are, getting it through fermented food, they do seem to improve the efficacy of different psychiatric medications. So, maybe they do a little bit on their own, but paired with medication, they can do even more. I am a big fan of thinking of probiotic supplements, so pills as a band-aid. Maybe we have a acute cause of stress that our gut's really messing up, or we got sick or something like that, and we can take a probiotic supplement while we do the other things to make our gut feel better. But taking it as the sole source of gut health, really, it doesn't work. And it also kind of ignores the fact that some people actually feel quite a bit worse on probiotic supplements. They feel more bloated, they have more pain, things like that. So probiotics aren't like the all good, a be all end all of nutrition and gut health and stuff like that. So moving on to unsaturated fat, if we can skew our intake more to unsaturated fat, that will help reduce that systemic inflammation that we see. So y'all know all of those sources, but we want to try to do that in a way that we include nuts and seeds, we include avocados. Could we cook sometimes with olive oil? Could we have more fish? But we don't want to do that in a way that says, but if you eat beef, you're going to make yourself sick, or beef is going to make it worse, or like you can't cook with coconut oil, which can be a very strongly cultural connected food, right, to some people. So you don't want to demonize other foods, but maybe we can encourage the inclusion of those unsaturated sources. But fish oil is kind of a cool nutrient by itself. It's one of the few that you look at in studies that when given at high supplemental doses actually improves anxiety directly. So there was this cool study, this one right here that they're talking about, where they compared fish 1 gram of EPA to fluoxetine, and then they did the two together, and the fish oil and the fluoxetine actually worked almost exactly the same. So improvements on their the little quiz that they took that quantified their anxiety improved exactly the same, but in combination, again, it worked even better. So I don't really stress people to getting that exact 1 gram. I find that usually doubling the dose of whatever fish oil product that they have works really, really well. I've also have found that for people that are really resistant, they know they're anxious, they know they're depressed, but they don't want to get that diagnosis on their medical record, or they're scared of the stigma of taking the medication or whatever. A lot of times we can start taking fish oil, and it smooths them out enough to the point that they realize kind of how much they were suffering, and then they do go pursue, a therapist or a psychiatrist or whatever it is to kind of fix it the rest of the way. So it is really helpful. That's something that we as dietitians can really do. Obviously, there's interactions. If they're on blood thinning medications, you need to kind of put the caution on that. Also, if they are heavy alcohol users, we don't just want to double up on blood thinners, right? Um, Algae oil anecdotally does not make people burp. I don't know what the difference is, but if you have someone that won't take fish oil because they burp it, they can try this algae oil. It's the exact same fat, usually the same ratio, and most people don't burp when it's algae oil. So another individual nutrient is magnesium. So I'm just checking the time, see how we're doing. General research does not show improvement directly with anxiety, but if you have someone that's not sleeping very well, sometimes 200 milligrams can kind of knock them out a little bit quicker. And then with that better sleep comes better management of the other things that can help. So that's more of a roundabout way for them. Individuals that are gluten intolerant may see increased symptoms of anxiety if they continue to eat gluten. This is not everybody should get off of gluten, right? There are some things that are quite good for the gut in wheat, and so we don't want to just blanket nobody have gluten. But if we know or we suspect a gluten intolerance, then we should maybe trial that if it's appropriate for your client. So also at this top of the little triangle, right, is these herbs and supplements. So I'm very cautious about supplements. I do like fish oil. I like magnesium in some people. Creatine I've actually been using a little bit more frequently, which I don't think it made it on my list, but there've been some research on creatine recently as well. Um, this is kind of where your comfort level is. I don't have a lot of extra education on supplements, and that might be why I'm a little bit more hesitant, but clients tend to like them, right? So the big ones that I'm absolutely against taking is these medication or these supplements, particularly in conjunction with an SSRI. So we tend to think of SSRIs for depression, but they can be used for anxiety as well. And essentially, if you are taking a medication that is meant to increase serotonin, and you're taking an SSRI, you can lead to the development of the serotonin syndrome. Sorry, y'all, I can't talk all of a sudden, which can be deadly if it's not treated. So here are some supplements there that are pretty common in social media. They don't have great research on it. So, if y'all want to go back and research a little bit more, but studies are small, mixed, things like that. So other things outside of food, we do want to make sure that we're recognizing their cultural background, not demonizing foods that are very, very important to them, maybe talking in particular about like, okay, you like this food? Absolutely, that fits. How can we fit that in? Generally, the food people worry about is not food that I would want somebody to eliminate anyways, but we do have this very Eurocentric kind of a in that wellness, sphere, where a lot of culturally important foods are demonized. So that's a very big sensitive approach I have with some of my clients, or concern, I should say, that some of my clients have. So there's just a little bit more of that, but essentially what this is, if you're not sure of your client's cultural influence, you need to ask them. Generally, if you come at it from a place of interest and curiosity, they're more than willing to talk about the foods that are important to them and why and how they think about food, and all that's important. You can't help them if you're working at odds against what their values are. So other lifestyle considerations are behavioral therapy, gut-directed hypnotherapy, which is like a new favorite thing of mine, body image, exercise, meditation, and mindfulness, journaling, maintaining relationships. This is a big one with my clients, actually. I have actually had goals set that like your whole goal is to pick a day and go out with some friends, right? They need to socialize. And even people that consider themselves introverted, it may look different, their socialization, but they do need to socialize. So this is another little soapbox of mine. You as a dietitian need to take control of your scope. Not everything on here is 100% in your scope, but a lot of it is. I can absolutely 100% go recommend someone see a therapist. This gut directed hypnotherapy. I actually have a link. I can get you a discount, right? A Nerva app, by the way, love it for gut health. If you have training, absolutely, you should be talking to your clients about body image. If you've never talked about body image before in your life, you don't need to go try to counsel your clients on it. You do need some guidance and education and stuff like that, but it can absolutely be within your scope. Exercise, same thing. Now, I'm never going to create an exercise program to build X amount of muscle and, that kind of thing, but we can talk about like including exercise, right? So take advantage of your scope. You can talk about sleep hygiene. You can talk about stress management. All of these things are perfectly fine for you to chat about. Let's see. So I kind of put here, like, there's things that I'm great at talking about. I'm not going to see a kidney client. I would not do them any good, right? So just same thing with you. If you don't feel comfortable, we can find somebody that can help your client with that. So exercise is one of the most important things that we can do as dietitians that can help with anxiety. So it can act as a distraction. It reduces muscle tension. These neurotransmitters are super, super important that come with exercise. It also activates that part of the brain that is responsible for executive function and can moderate our responses to stressors. Any exercise seems to help. Aerobic exercise seems to be most effective directly, even more so when it's green exercise. So if we can go on a hiking trail, that was walking and hiking, by the way, or if you want to go to a pretty park, something like that. But before all of that happens, we really need to see if we're moving around throughout the day. Somebody sitting at their desk all day and going to the gym for an hour at the end of the day is not going to get the same benefit of someone just getting up every hour and moving. So that's something that my clients actually find really relieving, and that's a lot of early goals too for them. So this BDNF, if y'all are not familiar with it, is a brain-derived neurotropic factor. And essentially what this is doing is increasing the neuroplasticity in the brain. So the ability of your brain to think about things in another way, right? So exercise, your muscles will actually produce this during exercise. And this is why they're looking a little bit more at strength training to reduce anxiety as well, because really working those muscles, and this does not mean like CrossFit, but like doing some strength training does seem to help increase this by quite a bit. So other things that increase BDNF if exercise is not available is getting those omega-3s, that Mediterranean-like diet pattern. Again, we're being culturally sensitive, so everybody knows what the Mediterranean diet is. That does not mean everybody is going to follow it. So essentially, are we getting in lots of fruits and vegetables, beans, nuts, and seeds, however that looks like for your client? Branched chain fatty acids, which generally I don't talk to people about, but just getting enough protein in can help as well. And then long-term high-fat diets, so ketogenic diets, tend to maybe short-term help in some cases, but long-term it does tend to reduce that BDNF and cause anxiety to get worse. And also, this may even have impact on that woman's like grandchildren, right, or great-grandchildren. So it's something that we need to be aware of. Other things to increase neuroplasticity. So remember, neuroplasticity is allowing our brain to think in a more flexible manner. So seeking novelty, taking a new route to work, trying new foods, right? Learning a new skill, sleeping enough, meditation and mindfulness, having music on, music in general, but like on the background while you're working. Curcumin, again, if you want to do supplements, you can do it as a supplement. I tend to tell people just put it in your food. It's bright yellow, but it really doesn't have a super strong flavor. So it's really not that hard to incorporate, even if you're not like eating Indian food. And then again, affectionate social interactions can help with that. All right, I guess that was it. I thought I had one more slide, sorry. But yeah, definitely reach out to me if y'all have any questions. I'm going to stop the share. Okay, I didn't go over that long, so awesome. Let's see. Going to go ahead and stop the recording, you guys. So if y'all have any questions, go ahead and let me know.